Take that card with you as a reminder there, alright? We need you on antibiotics for about a week before surgery, so it sounds like you'll be off right on time. Guess you'll be off sometime next Wednesday? Is that about right? Tuesday, Wednesday next week?
Yeah.
Okay, I think that'll end up being okay for... Yeah, I think that'll be right about the time we need you off. Do you have any questions about anything?
Do I need to stop any of my blood thinners?
You're taking Eliquis, correct?
Eliquis, aspirin. Because I had some oil surgery done, they made me stop it a week before surgery.
Yeah, I need you to stop the Eliquis and the aspirin and the fish oil about a week before surgery.
Okay.
And then the morning of surgery, don't take any of your diabetic medications.
I hate to say I'm done, but hang on. Which ones are those?
The pioglitazone,
Hang on a minute. 30 milligram?
correct. And then the Tradjenta.
I don't take that anymore.
Okay. So just the pioglitazone then. I think that's
And that's the morning of, you said?
correct. Yes, sir.
Okay.
Looks like that's all of the bumetanide. What bumetanide is.
Bumetanide?
Oh, diuretic. That's right. Okay. Yeah, bumetanide. It's a diuretic.
How do you spell it?
Bumetanide.
That's my pee pill.
Correct. Yeah. Yeah. That's. You go ahead and.
Well, I wouldn't take it the morning of because then I got to pee all morning.
Yeah, but if you don't take it, then we may have blood pressure issues during surgery.
Okay.
So.
And the only thing that is different in my blood pressure medicine, that LOSARTIA, I'm taking a half a pill a day. Instead of 100, I'm taking 50.
50, okay. Yeah, the morning of surgery, I'd like you to take the carvedilol and losartan. Assuming you normally take those in the morning. Correct, carvedilol.
Yeah, CARVED.
Yes, sir.
Yeah, I take that. And what's the other one?
The losartan, the one you just mentioned.
Yeah, I take that in the morning.
Go ahead and take those for me in the morning, okay?
Okay.
And go ahead and take the bumetanide as well.
Okay.
All right. We want your blood pressure to be in good shape for surgery, so we don't want to have to worry about giving you. The better your blood pressure is going into surgery, the easier it is on anesthesia to keep it controlled. Okay. So if you go into surgery and your blood pressure is too low or it's too high, then they're chasing it up or down during the whole surgery. So it's better if you go ahead and take the medications to keep your heart in good shape. You're keeping me on my toes this morning with all these medications, man.
That's why I got a list.
Are you still taking the Cilostazol? C-I...
LOSTA?
Correct.
Yes.
Okay, I need you to stop that a week before surgery too.
Okay.
I think that's about it, man. Everything else looks like we can just kind of hold off the morning of surgery. Any questions about anything?
He said I'd be in there about 3 days, maybe 4 days.
Yeah, it all kind of depends. Generally, people are 3 days. Sometimes their pain isn't controlled. Sometimes our patients that have multiple medical issues, before we cut them loose, we have to make sure they're stable. All right. So if your blood pressure's too high or too low, or your kidney function doesn't look quite right, then they'll hold you for an extra day to make sure they have it stable before they let you go.
Okay. After I get released, where would either go home or I go to a rehab?
Either or, whichever one you'd rather do, they will help you set that up at the hospital.
Okay. I have nobody at the house anymore.
Okay, so it's probably better that you have two options. You can go home and home health and home physical therapy can come to your home and help you out. Or you go to a place like Windmill or Health South or a couple other places where you actually stay there.
Yeah.
And you do your therapy there, and they do your meals and everything else. So
I think it'd be easier to do that.
okay, and they will help you at the hospital. Social services will come visit you in your room. They'll iron all the details out. They work with your insurance to get it all set up. They arrange for the transportation, whole deal.
Okay.
All right. Any other questions?
That was all I had.
Okay. So you'll check in at the hospital, 6 a.m. Surgery will be probably about 7:30ish. Procedure lasts about an hour and a half. After the procedure, you'll go back to recovery and hang out till about 10 a.m. for about an hour. So your surgery should be about 9ish. You'll hang out in recovery till 10, 10:30, somewhere in that range. You'll go back to your room. After you go back to your room, then friends and family can come visit. After the surgery, Dr. Wilson will come out and talk to family, let you know how the surgery went and everything. You'll hang out for 2 nights, maybe 3 nights, and you'll be released on that 3rd or 4th day, depending on how you're doing.
Yeah.
They'll help you get set up in the rehab, and then we'll see you back here in clinic about 2 weeks after your surgery.
Okay.
Okay? And they'll get you that appointment card over there at the hospital, too.
Okay.
All right?
Do we need to take a Sharpie and write on the left knee, not this one?
No, he'll come and see you that morning.
Because
Okay. The reason being, the first time the lady called me, we
There's
was
some
talking,
confusion.
and she says, "We are working on your left leg, right?" I said, "No."
Right. Gotcha.
And then she called me about a week later and said, "I just making for sure. We are working on your right leg, aren't we?" And I said, "Yes."
Okay. Yeah, there was just a little confusion on Dr. Wilson's chart, I guess, because did y'all talk about both your legs?
Yes, he
I
gave
think
me
that-
a shot in my left leg that day.
Okay. So either she read the chart wrong, or sometimes Dr. Wilson writing things down, he wrote left knee surgery, injection right knee. Sometimes he'll jumble the two.
Yeah.
So occasionally it's whether his end or the nurse's end, there's just a little confusion, but I've got it right here, and I'm the one that sends the final paperwork, and I've got right total knee replacement written down, so
okay.
we'll be in good shape.
The shot that he gave me that day, how long was it generally good for?
It varies per individual. Some people get great relief for months and months. Some people in the last couple of days, couple of weeks.
Because it works, and then all of a sudden it don't work.
Okay.
I don't know if it's the weather changing it.
Could be activity level. Sometimes your knee may have been in a condition that it was just a little bit too beat up for the injection to really work that well for you. So it really it's a highly variable treatment.
Yeah.
Some people get great relief for a very long time, 6 months, a year sometimes. We'll give it. Sometimes people, I never noticed any difference. My knee never really stopped hurting. So it's really kind of hard to predict who's going to respond. Generally, people who've never had injections before feel better and get good relief. Sometimes it doesn't work.
Now, I'm not gonna say it doesn't work, because it does, but every once in a while I do feel that.
I would say that if it gave you any relief at all and it made your knee feel better, at least most of the time, then you win. Because some people get them and can't tell any difference at all.
How often should you try to not get one though?
Well, the soonest we'll give them is about 2.5 months apart, generally. Once people get down to where they're not getting at least 2.5, 3 months of relief, that's when we say we need to figure out some other way to treat your knee.
Okay. Because I know he said they wouldn't operate on it without at least 3 months not
That's
being
correct.
shot on.
That's
So.
correct. Have you ever had an injection in your right knee before?
No.
No? Okay. Yeah, kind of right through your last chart, you've been using the cane, you've tried physical therapy. I've seen you take a couple of pain medications. I know you can't take Advil, Aleve, Motrin, those drugs because of your heart medications and being on blood thinners. But it sounds like you really tried what you could, just didn't work. Any other questions for me?
No, nothing I can think of right now.
All right. There's one more person I need you to talk to. She is going to, Dr. Wilson always prescribes a couple things before surgery. Number one, a couple of creams to use on the knee. One of them's for pain, one of them's for the scar. All right? And then the other one is a surgical wash you'll use the night before and the morning of surgery. Okay? And they'll send it all to you in the mail, and she'll go over it a little bit more in detail with you.
Okay.
Any other questions, gentlemen?
She here now?
Yeah, I'm just gonna go. I'll point you back to her office.
Oh, okay.
It's literally like right across the hall here. So, any other questions, guys? Good to go. Okay. All right, I'm gonna step out. I will go get. Actually, you know what? Do you have any breathing difficulties right now at all?
Just my cough.
Just a cough. When you take a deep breath in, you don't feel like it's hard for you to breathe, difficult to breathe. Okay.
No.
Okay. All right.
Should I set up an appointment with my PC though, a week from now, just to get double checked to make sure it's gone?
That's not a bad idea. It's not a bad idea. Just to follow up with him after you finish up the antibiotics, that way he can kind of, because it would be generally when they give the antibiotics, you're good after that. All right, but it wouldn't be a bad idea to get in to see your PCP just so they can evaluate you one more time. Because if anesthesia evaluates you has any concern, then they may want to postpone the surgery
Yeah,
a
well,
week.
I understand that. But what did I have done? I guess I had my teeth done, and I had a cold. I had bronchitis at that time. Before they knocked me out, I wanted to get rid of that bronchitis.
Sure. Yeah, why don't you get in and see your PCP just one more time, if you can, beforehand. Once you finish up the antibiotics, you'll have another week before surgery.
Yeah.
So if you have concerns, let us know. Okay, if you can't get in and see your PCP.
I'll just go to clinic here if I can't get.
Okay, yeah, if you have concerns, let us know. If as long as you're feeling good, no fever, your cough is resolved, that you feel better, you feel good, I think we'll be just fine. But if you finish up those antibiotics and you still have any concerns, please let us know. That way we can kind of make arrangements and help you get that sorted out.
Okay.
Okay? All right. Well, I'm going to go let Skyla know, make sure she's in her office, let her know that she's about to have some company. She'll go over all that with you, and then you're free to go, and we'll see you the morning of surgery. And Dr. Wilson will come in and chat with you before your surgery, and you can point to that
Point
right
to
leg
right.
and say, this is the one, man.
Yes.
All right?
Yes.
Okay?
Okay.
All right, guys.
Thank you.
Thank you.
Good to meet you. All right. We'll see you soon, okay?
Okay.
All right, sir.